Today, we are going to work on hip walks. So how can you add this into your everyday life? You can add this into your life when you're maybe sitting on the floor if you have children that are young and you're playing on the floor, or if you are watching TV, get down on the floor. Remember, I speak about how you need to be sitting down on the floor more. Just the action of getting down on the floor and standing all the way up is going to be good for your hips. The exercise I'm going to show you right now is going to be taking that a step further, and this is called hip walks. This is a good way for you to kind of see how your hips are moving. And we want them to be moving well. So this movement will kind of tell you, are my hips moving well? And do I have a difference between one side and the other side, which is another key thing that is very interesting to know, because if one side is tight and you're not getting that movement, you may notice you have SI joint pain on one side, or, you're always dealing with that knee is always hurting or that foot's always hurting, because remember, we're all interconnected. So if my knee or my foot is hurting, it may have to do with my hip. So this may be that answer to that question. So they are hip walks. I like to do them down on the floor with my feet straight. If you have very tight hamstrings, you may want to keep your knees bent. All we are going to do is we're going to lift one hip up in the air, slide our leg forward and drop it down, okay? Then you're going to do the same thing with the other side. Lift that hip up, slide that leg forward, drop it down. If you have a mat, you can go all the way to the front of the mat, and then you're going to try to bring it back. I do think going backward is easier, but I want you to try both, okay? So you're just going to lift up, slide it forward, lift up, slide it forward, lift up, slide it forward, and we're just moving closer. This could take forever. You can even get down and just do it with me now and get it over with, right? Rather than just sitting and watching me first thing in the morning, if that's when you're watching it. And then we're going to go backwards and backwards, and you'll see backwards is a lot easier, I think. So feel free to let me know in the comment box. I think it's up in the corner. Let me know in the comment box what you felt. If you felt something, let me know. This is where I want to be able to help you start to work through the aches and pains that you're dealing with. I can provide you with information, some exercises, some tools that you can use to help you with any of these aches and pains that you are dealing with.